Okay, hey guys. Continuation from last night. We talked about the terms HIV and AIDS and what the letters stand for and how the virus works, right? And that has to be attached to certain cells in the body in order to replicate and live, right? So now we need to talk about how does HIV then get into somebody else's body? It's passed from human being to human being, okay? Well, it has to be in fluids of the body where there's a lot of T cells. Makes sense, right? So that's not every fluid of the body, all right, is not equally infectious. So since the T cells are white lymphocytes, okay, white blood cells, it makes sense that it's in those fluids. So for sure it's in blood. It would be in blood in very high amounts, okay, if the person were infected. It's also in semen, which is what is ejaculated by a male during sex. And it's also in the pre-ejaculate, or they also refer to that as pre-cum, which is a clear fluid, which comes out prior to ejaculation. Okay, and this is important to know, and we'll have this discussion in a couple of minutes, why you need to know that it's in that particular fluid. For women, it's in their cervical and vaginal fluids, okay, again, sexual fluids, and it's also in breast milk. Okay, and this is also important, again, ramifications for other people. So the reason that we talk then about, when we're talking about how people get infected and what they need to know, is because it is a sexually transmitted disease. It's passed in the sexual fluids besides blood. So, all right, so how would you get one or more of these fluids into another person's body? Well, obviously the number one way is sexual intercourse. Intercourse means penetration. Okay, so not just kissing or touching, okay, not with clothes on. Intercourse is penetration, and there's three kinds of intercourse, okay? If you haven't learned about these before, or nobody's talked to you about it before, three kinds of intercourse. The first one we'll refer to as vaginal intercourse, which requires a penis, okay? And that gets inserted into the vagina of a woman, all right? So that's one way. And that is a very, very good route of entry for the virus, okay? Very effective route of entry, because when the male ejaculates, all the fluid goes up inside of the woman into the vagina, okay? And inside the vagina, the walls are made of mucous membrane. So the virus can actually pass through that, okay, into the bloodstream. So a woman is much more likely to become infected from a one-time encounter, sexual encounter, than, say, a man would be, all right? Just because of the way our bodies are built, all right? It doesn't mean men can't get infected. That's not what I'm saying. But from a one-time exposure, a woman would be more likely to become infected from that, all right? So that's vaginal intercourse. The second kind of intercourse is anal intercourse, which requires a penis and an anus. And again, an anus, the regular word people use is butt, right? Butt, butthole, whatever you want to call it. You know what I'm talking about. And the risk there, of course, is that the anus is not meant for penetration. It's really meant for exiting things, right? So there's a lot of very small capillaries, little teeny blood vessels and stuff that are very easily ruptured, okay? So, and you can't necessarily see them, like to the naked eye, okay? Teensy little blood capillaries, blood vessels. So, if with penetration of the penis into the anus, that would also be a very, very good route of entry for the virus. Very effective, because the semen is there. It can get right up into those teeny little micro breaks, okay, in the blood vessels, okay? Again, very risky if it's unprotected, if there's no barrier between the partners. And then the third kind of intercourse is oral intercourse, which is a mouth, right, onto a penis or onto the vagina or vulva of a woman, sometimes even onto the anus, right, of another person. So you, again, would be putting yourself at risk. The person that is performing the act is at great risk for coming in contact, obviously, with the other person's body fluids. It could be blood, semen, vaginal fluids, okay? So you understand why intercourse, which is very specific, this is the penetration thing, is the number one way that most people in the whole world have gotten infected with HIV. And that, by the way, is by heterosexual intercourse, because predominantly in the entire world, that's heterosexual, meaning a man and a woman. That's how most of those people got infected, okay? It is a sexually transmitted disease. So it was never, even though in our country, people first started to think when we first heard about it, oh, it's just a thing that gay people have to worry about. That was actually never true, okay? A sexually transmitted disease is a sexually transmitted disease. And it's an equal opportunity disease. So anybody can get it. If they're sexually active, anybody could get it, okay? So, so those are three kinds of intercourse, and that is the one main way, intercourse, right, that we can get exposed to these fluids. There's two other ways. The second one, of course, is a blood-to-blood exposure. Usually we hear people talking about sharing needles, you know, and we think about it for, like, say, drug use. But it's not just drug use. Anytime you share a needle for anything. So that could be, maybe you have diabetes and you're sharing it for insulin. You're sharing the needles because you can't afford to get clean ones. If you don't clean those needles correctly, you know, with bleach and water and whatever, however they tell you to do it, then you are at risk, obviously, from coming in contact with somebody else's blood. People share needles for vitamin use and steroid use, okay? People share needles for tattooing and body piercing. Any reason, it doesn't matter what the reason is, if you're sharing the needle that has somebody else's blood on it, not been cleaned properly, then you are being exposed directly to the other person's blood, okay? And if that person, no matter what they have in their blood, HIV, can be hepatitis, could be whatever, okay? So that's a big kicker. And in the late 70s and early 80s, there were people that got infected through transfusions. That would be the needle, you know, saying a needle, blood exposure, blood to blood, because our country, the way that they were collecting blood, was not a good way. They would pay people to give blood, and then they didn't test the blood. So we now test all blood that's donated. So that's a very good thing, okay? So that's changed, and that's why we're not seeing transfusion cases, okay, for HIV now. The other way there with the blood-to-blood thing is they made blood products from the blood supply for people who need blood for other reasons. Like my late husband, who had hemophilia, he was born with hemophilia. That is where your blood doesn't clot correctly. They're missing some factors in your blood, so it doesn't clot. And the only way they could treat that, at first they were just doing it with whole blood transfusions, but then they were able to take out the certain factors from the blood, make like a medicine from it that you would have to inject into your body. And so many, many people got infected with HIV and hepatitis and other stuff that's in the blood from the blood products that they use to save their lives. And that is a very, very tragic story that a lot of people don't know about. They're not aware of it, okay? So that's the whole Ryan White connection, by the way, which is about the song that you listened to this week. So look that up online and check it out. And then the last third way that people get infected through, infected with HIV. So the first one's intercourse, right, sex. The second one is blood to blood, or sharing of needles for any reason. Actually, any sharp item, not just a needle. So you don't want to share razors, okay? You don't want to share a toothbrush that might have blood on it with somebody, okay? So any sharp instrument. And then the third way is from moms who have HIV, they can pass it to their babies. And that means that a woman really needs to know her status, because the baby can become infected while the baby's still inside the mom, okay? Or when the baby's coming out in the birth process, if it's a very difficult, complicated birth, the baby might be exposed to the mom's blood, could get in the baby's eyes or in the mouth, okay, and infect the baby that way. And then certainly after the fact through the breast milk. We said it's in breast milk too. So if a woman doesn't know that she has HIV, and the likelihood that her child will be born without HIV, because it's only a 25% chance, right, that she will pass it on to her child, then if she breastfeeds them after the fact, right, with the breast milk will infect them. Because little babies, as you know, a lot of mucous membranes in the mouth. Also, they might have teeth that are coming through the gums, right, erupting. And that would be a wonderful, again, direct route of entry for the virus to get into the baby's body. Okay? So to right, to recap, 3 ways that people get exposed and infected with HIV: intercourse, right? Number 1. Number 2, the blood to blood or any sharp instrument, right? Exchanging of blood. And then the third one is moms to babies. Okay? We'll take a short break, come back with another video.